So today our guest, Dr. Yasmin, and today she will be talking about AI in pediatric dentistry.
I wanted to draw my patient journey.
I will just put myself in front of pediatric patients. They are not easy.
Yeah. No, I'm not going to be able to crack this kid. I need to separate him from the parents.
The trends which you are saying, for example, Labubu trend.
Oof. I jumped on that trend idea. So there is no doubt that AI is the future.
That you can predict how your kids' teeth are going to be.
Do you think our patients are ready to hear that? You know, AI, it's good to have a little robot in the waiting area telling them, brush your teeth and things like that.
I have seen teenagers with they lost their personality. They don't smile.
Yes.
They became introvert.
Let's give you a patient with autism and a child on the spectrum and pretend to see your empathy, your skills, your communication. How are you going to talk to this child? How are you going to reach this child?
It's not your cooking recipe. You are not cooking a cookie. It's a human being.
أباك لا ما أباك أبا أقول chi, and then you like this, and then he obeys. As our patient is here still thinking baby teeth are worthless, and we are here. We need to get this patient to hear.
Hello, my name is Dr. Khalil.
Dr. Khalil Karam is a digital transformation strategist. As a creator of the Moz concept in Fujairah, UAE, he integrates technology with aesthetic care to transform patient experiences, shaping the future of digital dentistry across the UAE.
In nextdental podcast, I'm an expert in digital dentistry and in AI. So today our guest, Dr. Yasmin.
Dr. Yasmin Kottait, often called Dubai's Tooth Fairy, is a specialist pediatric dentist with nearly 2 decades of experience. With an MSc in pediatric dentistry and MFDS from the Royal College of Surgeons of Edinburgh, she transforms anxious first visits into confident smiles and leads the way in inclusive, sensory-aware care for autistic and neurodiverse children.
She's a pediodontist, and you know her from social media. She is very active, and every kids I can tell they love her. Not they like her, they love her. Mm-hmm. Dr. Yasmin, she has experienced more than 15 to 20 years in pediatric dentistry. She has been in academic part of pediatric dentistry. She has also experience in running her own pediatric specialized dental center. So she knows everything about pediatric dentistry, and today she will be talking about AI in pediatric dentistry. Welcome, Doctor.
Thank you so much. I appreciate the invite. Thank you so much for inviting me on nextdental.
Of course.
As a pediatric dentist, you have a lot to learn. Okay, you have a lot to learn, and you have a lot to be, and you have a lot to acquire. To get to be, the word best is great, but to be the best version of yourself that serves these kids the way they want. So I'm a bit amazed that you still remember me from when I was working in Nicholas and Asp before. That was like 15 years ago. Isn't that awesome?
Exactly.
And yes, so I finished with that, and I decided I'm gonna go on my own. And once I decided I want to go on my own, I said, the patient journey is very important. I wanted to draw my patient journey. And I wanted to draw the patient journey up to the highest quality standard of care, and use all the AI technology, or again, the digital technology that we can. So instead of the normal needle, have a digitized needle, the STA. Instead of, just behavior management, have conscious sedation, nitrous oxide. Okay. Again, it's all about the tools that fit pediatric dentistry, that makes pediatric dentistry work very easy, and it helps the child relax more and helps the child really trust the dentist, which is not that easy at all. Even the parents trusting the dentist, not that easy at all. And then helps the child grow up with not fear of dentistry, not aversion to dentistry, loving dentistry, wanting to go to the dentist.
I think, Dr. Yasmin, if knowing you for the past 15 years, going from one stage to another stage, or from one success to another success,
Thank you so much.
you have gained certain, I would say, powers, because with the powers, the responsibility comes.
Right.
And I think the kids, because you are not dealing with adults, you are not dealing with the adults. Adults, they express very well. Now, let's do a little bit profiling of your patients who are not adults, and who are your typical patients in your day-to-day, and what are different with these patients than the grown-up patients?
Well, there are types of kids, just like there are types of adults. To understand personalities, basically, there are 4 types. Let's just simplify it. 4 types of personalities, right? And there's a very interesting read. It's called Surrounded by Idiots. I don't know if you read this book, but it categorizes people into 4 different colors. The red, the green, the blue, and the yellow.
Okay.
And kids, of course, some kids are social kids. They want to talk to you. They want to, they are the expressive kids. Some kids need the sense of control, which is the red kids need, I do it. I can do it. And the green kids need a lot more love, and the blue kids need to feel in order. And put on that, for kids, again, you have to put a lot of factors in, okay? Generations now make such a big impact. Alpha. Now there are beta kids, by the way. This year, beta started.
I know the Z gender, that's
Z, alpha, beta, And also on top of that, what is their environment at home? And based on this, you get to say, this kid needs a lot more love. This kid needs a lot more structure. This kid, no, I'm not going to be able to crack this kid. I need to separate him from the parent.
I think that's very enlightening, because as a GP dentist, I see a lot of kids, but we don't focus on all these things. Our focus mostly is, or the difference between them and our regular patients or the adults, are the anatomical basis. So basically you have primary teeth and this other, but we don't go to the other dimensions which we have basically categorize them. I think that makes a huge difference. Being a parent of 5 kids, they don't look the same. I trust you.
Absolutely.
They never.
Absolutely.
I have the naughty one. I have the one who obey me, and the one who rebels me, and the one who makes me think how to deal with them.
And the same sentence, the request for each 5 is different. And the one that obeys you, Baba Habibi سوي صح؟
Done.
And the one that rebels you, تعرف أباك لا ما أباك أبا أقول چي and then you like this, and then he obeys. You cannot just tell him the same sentence, right?
Yes, exactly. I think that's the diversity in pediatric dentistry, which is being overlooked now, especially with the new generation of pediatric dentists. They don't try to understand the
dig deep.
Exactly. They don't, because working with a lot of pedodontists, it's a GA case, as simple as this one. Just it's like, when you are trying to treat an animal, you sedate them completely. So the kids, they don't get that interaction with the dentist. They don't feel the cognitive part, the behavior part. I think, and
the influence part.
Yes,
you can influence them with a smile.
I think that makes a huge difference in their life.
Saying hello, or but the minute they walk in, you look at them and you understand their story. When you understand their story, that's when you're able to talk what they need to hear, to say it the way they need to hear it, and for them to be able to answer back, or
I mean, that's one of the challenges. Even again, I will just put myself in front of pediatric patients. They are not easy.
Yeah, they're not.
They're not easy, and each age has
special skill.
Yeah, each age has their different things, and it's not you are dealing with the patient himself only. You are parenting their parents.
صحيح.
It's not easy to deal with them. So if we come and try to categorize the kids on chronological aspect, right, the age of the kids, do you think there are different behavior patterns there, or what are the factors you consider them as Dr. Yasmin when you are dealing with these kids based on their ages? That will be very enlightening if you can.
So that's a great question. So if we want to categorize kids based on their ages, again, remember I just mentioned a second ago that there are so many factors. But again, to simplify it, 0 to 3. 0 to 3, is their logic mature? No. So what do they need more of? They need to feel safe. All the kids need to feel safe.
Of course.
But 0 to 3, they extra need to feel safe and need to feel the emotional connection. So, for example, you're seeing a kid 0 to 3, you want them to open the mouth. A lot of parents come to me and say, oh, بيلعوش, بيضربش. And he's 3 years old. So I just tell them, okay, step back, let me do my magic. So I come, I say, hi Khalid, how are you? High five, physical touch, okay? And then Khalid's like, oh, doesn't seem the enemy much. Khalid, شو هذا? Play here, سوي شي, look هذه لعبة, look هذا TV, distraction. And then Khalid is suddenly feeling, oh, she looks like a friend. What did I do? I came from an emotional perspective, okay? And then the more you come at emotions for these feel safe, and then Khalid, show me your teeth. Done. And the parents are like, oh, how did you do that? Because I didn't come say, open big. He's not an adult. He's not a mini adult. And open big بيفهم. And that's why from 0 to 3, emotional connection first. From 3 to 6, emotional connection first. Then comes a little bit of imagination, a little bit of fun. Because from 3 to 6, they understand more the life around them. And they understand more why. So actually, I have a little lion.
Okay.
And it happened that the little lion lost his teeth
Okay.
due to an unfortunate accident by another kid. But kids don't know that. So whenever they come, I'm like, what happened to Leo the lion? And they're like, oh, kalhalawa. He ate sweets. And that's why his teeth are bad. And I'm like, yes. And they get it. And then I'm like, can I check your teeth? Guess what's the answer? Yes.
You can get the teeth. I think the influence with the kids, you mentioned emotional dentistry, the empathy practice in healthcare, it's being highlighted so much. And I think the best who excel this part of healthcare as overall, they are the pedodontists.
Yeah.
They know how fragile is the human being from a sentimental perspective.
Right.
So a simple gesture could make this kid very compliant with your treatment, or very annoying or difficult or resistant.
Right.
So empathy is very
Runs
important.
for the door.
Exactly. This is what happened. And again, doctor, being a pedodontist, you have a hard job of following what's going in the social media, because you need to be updated with these kids.
Yeah.
So,
They're
for example,
tech-savvy.
I think
They're born with a phone in their hand. Literally.
Exactly. Now, that will be the next thing I will discuss with you. But the thing is, the trends which you are saying, for example, Labubu trend.
Oof. I jumped on that trend عادي يعني.
It's a lot. I think there's a lot of things, especially with their teeth, smiling teeth. I think those sort of trends brings you tools which you can implement it, because, as you said, kids, they want someone to be near to them.
صح.
They want someone to understand them.
They understand them.
They need them. But if we go there, unfortunately, the parents' role this is what is missing in UAE market. Not everyone, or not all the parents, especially if we say Emirati or locals, we have still the same culture of those are the primary teeth and they are going to shed off.
Yes.
And we don't take a good or the minimum requirements of taking care of these teeth. So I want you to just give this, just to highlight this issue and how the parents should deal with their kids, starting from these different age categories of the kids.
So yes, it's so the point you highlighted, that still the awareness is not widespread is true. But again, in all fairness sense, for all fairness sake, for the great parents of nowadays, most parents nowadays, the millennial parents, they are actually showing up. They're understanding. I got kids that are 6 months, 1 year, which never have happened in the past. So the awareness is spreading and it is improving. Okay. And with that being said, my first piece of advice for a parent, new or have a lot of kids, is first see the dentist no matter what. First year of life, see the dentist. If it's not for a problem, don't wait for problems to see the dentist. Have a preventative mindset, okay? Even if the child's teeth are baby and they will fall, but do we really want the child to have pain in their teeth before the child's teeth fall at 10? And that is why, whatever stage the parent is in, always see a pediatric dentist regularly. Follow, all the information is everywhere now. You can ask ChatGPT anything and everything,
exactly.
and they will tell you. So, like we ask ChatGPT little things here and there, we ask GPT, how can I have a healthy child? Then you will know that dentistry is a big part, an integral part of the health and the body health that we often overlook.
That's the holistic approach, which is I think the direction of contemporary healthcare.
Yes.
And
you don't look at the tooth.
No.
The tooth happens with a child. You look at the child. The tooth is khiliwali. The tooth is not important.
Exactly. They usually overlook it. Again, this is the main thing. Even as dentists, as a professional, they just ignore what they don't know. They don't know what are the kids' needs. It's not only cleaning or whatsoever. It's there's a lot of things. I think even the kids, the generations now, 6 years, 7 years, they get bullied for their when they lose their tooth.
Yeah.
We never felt these things.
No.
We never even the perception of these emotions
It's much different.
is
now.
different.
And kids see, subhanAllah, kids are very visual. So they really see you. Not like us, I see. But kids, they study your face. And the face has half of it the mouth.
Exactly.
And that's why now facial aesthetics, growth and development, the tongue, I had a child, I had to remove 2 teeth for her because they got an abscess. And then the mother, the next time, told me, even the teeth are at the back. She's getting bullied for having no teeth at the back. Imagine,
No way.
the kids are ferocious. And they look at the back.
Exactly.
And she's only 5.
This is exactly what made me very conscious about my pediatric patients. Was that because I have seen teenagers with they lost their personality. They don't smile.
Yes.
They became introvert.
They smile like this.
Yes, exactly. They never. And I have treated many of them, and it was a life-changing event. But I wasn't what was the root cause of this problem. It was somehow a dentist who did not say, let it take it to the right person, or the parents did not take the kid to the right dentist. I think we need to focus on specialization more than a broader scope of work of dentists. I think this topic is very crucial now, especially we have enough specialized dentists. We have the access to these these specialties. So what do you think as a GP dentist, what they need to do so they properly allow those kids to have the opportunities of right growth without pain, without a negative feeling toward this one. So what do you advise for the dentists, as a GP dentist, to do these things?
So I would advise for GP dentists to attend courses, to get educated, to attend conscious sedation courses, to attend white crown courses, to attend silver crown courses, to attend diagnosis courses, to attend growth courses, to attend all these courses, so then they know what's their scope, whether something is harder than their scope or something within their scope. And honestly, the more they learn, the more they really know what to do and how to do it. I have started referring out my endodontic cases, although they come in kids, so it's within my scope, right? But if I do it in 2 hours and someone much faster than me does it in half an hour, do I want to do it in 2 hours or refer to him, do it in half an hour?
Of course.
I come do the sedation and the talking, la 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 la, and the happy talk, and then the endodontist finishes his job from top to bottom in half an hour. The more you know, you don't know.
Exactly. I think that's the thing. But let's get to the big title, big topic, which is the AI. I think part of our, we cannot resist the AI anymore. Right. It's our culture. This is everywhere. The culture. This is the pop-up culture now. But the thing is, for example, even today talk, it's partially being prepared by AI. So we cannot say that we are doing everything by ourselves. But what is AI and how is going to change pediatric dentistry?
So now we live in a digital era. Everything is digitized, from the injection, from the sedation, from the patient recall, from our softwares that govern our life as patients, from the check-in, from the checkout, all digitized. And honestly, AI is such a force that it is taking the world by storm. So there is no doubt that AI is the future. But now, again, I'll be the devil's advocate. We shouldn't rely on AI too much. We should take the best of the AI, but not the disadvantages of the AI. Because AI, you ask ChatGPT, tell me more about decay, blah, blah, blah. Oh, good stuff. But if I come and tell you more about decay, and I'm a dentist and you come to me for information, you're going to get a lot more out of me, more than ChatGPT. And it's connection. So as much as ChatGPT is, we're using it and it's great, we as dentists need to educate our patients this little bit more to work with ChatGPT and use it as a great tool, but not to lose our substance, not to lose our core.
You mean, Doctor, that the AI is a tool?
Is a great tool.
Is as Dr. Fox described, is an augmented intelligence. It's not artificial intelligence. So it augments your work.
Exactly.
It helps you.
It needs us to guide it.
Exactly. But let's say I have been reading a lot of articles recently about AI, and I think there are few articles in the field of pediatric dentistry which attracted me a lot. There was a Korean article talking about prediction models of early childhood caries.
Right.
Imagine what they have been doing. They are trying to forest the data enough, and with different factors, considering different factors, the parents' age, their social status, their job, and all these things, and predicting the kids who they will have in future.
Right.
In future, and how much caries they will have.
Right.
I think, Doctora, you as a pediodontist, you know that always the parents, when they come, my kids, always they blame the caries to the genetics or to the inheritance. Right. It's in our family, so we have poor teeth.
Right.
But I think with AI highlighting these models or bringing such a models will be a breakthrough.
Yes.
That you can predict how your kids' teeth are going to be. For example, imagine if you have a score of your future kids, either maybe male or female, how much the caries index will be. We are in an era we are expecting to see new diagnostic tools.
Yeah, absolutely.
So, what do you think of such a direction of pediatric dentistry, and how this will help you as a pediodontist in I would say near future?
So the Caries-risk model is not new.
Yes.
It's not new. There are so many, and there are so many actually programs that, you put these data, the parents'
the
age,
inputs and everything,
the saliva, there's the habit, and it shows you high, moderate, low. And it works. It works. It has its space. And especially if you give it to AI, and then you don't have to do the dirty work, it works quick and amazing. But the but I have here is, do you think our patients are ready to hear that? I think not. I think, and you know what, this caries-risk is khalas, it's ingrained in a pediatric dentist's minds. I'm always thinking people, high, low, caries. Yesterday I got a patient. I had three siblings. One I did x-rays for, and the two not. Why? Because one, I know he is a high caries-risk, but his siblings not. And see, I didn't even use a model or whatever, because it's ingrained in me. Now, the new generation pediatric dentists, we need them to have this caries-risk model ingrained in them. And the more we educate our patients, the more the patients, when they see, AI is showing me, then they are on board. But the thing is, right now, where I see it, is our patient is here still thinking baby teeth are worthless, and we are here. We need to get this patient to here to see what we see and be on board with what we want to do.
I think as a communities, we have a trust issue with AI.
You're right.
It's a growing trust issue.
Right.
I have read an article that it states that, or the conclusion was that the AI trust is decreasing because of the threat they see it on themselves. As a human being, we see AI as a threat for us. But I think we need to think a little bit further more, because it's a tool. We set it as a tool. The tool could be useful tool
Right.
in the right hands.
Right.
So let's say I've been using the AI radiography, the
It's
detection.
amazing. It's great.
It's an amazing thing to do it. And have you tried it, Doctor?
I just did those quizzes, you know, and I thought, I know my stuff. And I ate humble pie.
You know, like I will tell you,
Because that would predict a lot of future, which I wouldn't. So AI, especially in this caries detection model, is the best.
I think let's make it a little broader. AI in diagnostics.
Right.
So detection, radiology is a part of that one. Detection, as you said, Doctor, you cannot depend on these tools 100%.
Right.
And you said the trust issue with the parents, but it's a good tool because the language of this era is AI.
Right.
That's a culture. So
I do have another. See, I told you I'm going to be the devil's advocate to tell you the pros and then the cons, and to tell you what I think. Now, again, I'm a pediatric dentist, right? For many, many, many years, and I see an X-ray and say, look here, look here, look here, look here, and I can, this one is for sure root canal. This one, no, it's not yet. Something like that, right? But then, if I am completely depending on AI to do my work for me, what's happening to my brain? So according to a very interesting study, it
sort of recession happens in your...
Exactly. So it was comparing between people heavily relying on ChatGPT and people not, into writing an essay, right? And the people that heavily rely on ChatGPT while they're doing an essay, they concluded that they have less neural pathways firing to be creative. And the people that are not counting on ChatGPT have good neural habits, good memory retention, good. But people that are heavily relying on ChatGPT, their neural pathways are being trimmed. So in other words, they're becoming dumber. So again, as dentists, we should be very, very, very careful to rely, but not to rely.
Do you think the human race is going toward a devolution?
The human race?
Yes.
Exactly. If you don't use it, you lose it. Part of the brain as well.
Exactly.
If you're not becoming creative and developing new problem-solving abilities, it's all about problem-solving and creativeness and thinking outside the box and, sitting like this and struggling with it. ChatGPT, what can I do?
I
Done.
think it's the core of your field of pediatric dentistry, because you see the growth of the kids, the cognitive growth and physical growth, they are related to experience.
Right.
So once you don't experience and you have a reliance, for example, you see the kids who rely on their parents so much, they will ask the permission of their parents. Should I sit? Should I don't sit? Should I do it? In each while he will try to take the permission directly or indirectly from the parents. So AI is a great tool.
It is.
But we should not be very dependent on AI,
Yes.
because we are going to lose our skills.
Right. Exactly.
The
Exactly.
skills are I think this message should go to the educational hubs or the universities. They should not, or they need to monitor or restrain or such things.
Exactly. Use it in a way that serves you, but make sure it's not using you. You are using it.
For example, so what I did the couple of 2 days to prepare this discussion, I went through ChatGPT. It gave me an outline, but I went to my traditional way, which is the Google way. And again, I read articles, I read reviews, I have read other articles, business articles. So I know the AI is so easy. It's a spoon feeding you,
Right.
and you should not be spoon feeding.
Right.
So I think that's the part we need to. Even this podcast is about AI and pediatric dentistry, but it's not only the positive part. Even the negative part, we need to be alerted to, so we don't get engaged so much that then we start losing everything.
Right.
We are already losing our precious 5 to 6 hours daily, which is the average phone use, by the way.
All right. 5 to 6 hours.
Yes.
Interesting.
It's
I'd be surprised, not more. But yeah.
No, it's a long time.
Yeah, it
because we like human. They start tending to like watching even the series, the movies.
Right.
And their smartphones. Can you
Right.
imagine?
Yeah.
And it brings a very
Scrolling.
scrolling.
The kids are just like
That's
this on
a-
YouTube.
That's an addiction, the
Yeah.
scrolling. Now, it's very important.
Even the younger ones, the 2 to 3 years old, I see them. What do they know? Nothing.
See, doctor, I have tried with my kids. Like you need to pull it out from their hand.
Right.
Then only they will sleep.
And it's a tantrum.
It's very, very alarming technology. But again, let's say diagnostic, because sometimes we do skip certain diagnoses or due to being underqualified, or you don't have that experience, or even for medical legal aspects, you need someone who helps you to find these diagnostic markers on your x-rays.
To teach you.
To teach you.
Teach is different than spoon feed. And if AI is used to teach, then it's in the right spot at the right time. But if it's learned to spoon feed, it's not.
No, it's not. I totally agree with that thing.
And I'm on Instagram, right?
Yes.
I'm kind of known on Instagram. So I get a lot of pediatric dentists who are students texting me and telling me, this is the x-ray and this is what ChatGPT gave me. What do you think? And I'm like, yeah, remove this, remove this, remove this. Why is this like this, So imagine the student has an x-ray, and to write their essay or assignment, they're using ChatGPT. And of course, ChatGPT, everything it knows. And I'm like, no, if it has, for example, a periapical abscess or a periapical radiolucency or a bifurcation radiolucency, no, you cannot put reversible pulpitis anymore. This is actually periapical abscess. That's the only diagnosis there. So even students nowadays, they're growing on a pediatric dentistry model that is so reliant on AI that it will not make them learn well.
I think it's very important they should know that AI it doesn't work on the same way as a human brain works till now.
Of course.
And reliability on the information for AI, it brings from everywhere. So you don't have a controlled models.
Right.
It's not a controlled model which detects. Now, if we go to the controlled models, they have been through a lot of machine learning process, so they excel at very specific tasks. For example, finding or identifying those markers in the knowledge itself.
Right.
But they say it's an augmented
Right.
intelligence. It's not substituting you. So you should not be following them blindly. It's not your cooking recipe. You are not cooking a cookie. It's a human being. Again, that part may be very easy when you are trying to translate what AI dictates on you or tells you to do for the tooth with an adult because he's there. But with the kid, your cognitive part or the behavior part, AI cannot help you, or maybe it can help you. So what do you think could be the new frontiers of AI where it can help you in management of the pediatric patients?
New frontiers where AI can help in pediatric patients?
Yes, it's a very
It is.
it's an awkward question, but
It's
let me rephrase it in a different
Yeah.
way. I think, for example, the chatbots. Well, I have read some
Right.
articles in business. They were talking about AI chatbots specifically made for the kids. An interactive one. How is imagine if someone is trying to it's like a Dr. Yasmin, she's trying to obtain certain information or trying to break the ice with this kid about the dentistry. So those chatbots, they bring the information and they are freely. For example, you just put that iPad or a small mini robot in your waiting area and it starts, making conversation. It
Interacting.
interacts, exactly. So
And kids would love that. That's their new world.
I think there are some models there, but they are still not tailored to the kids. And that's why I'm telling you, there's a huge gaps
Right.
in AI when it comes
Right.
to pediatric dentistry
Exactly.
because they don't understand or they might understand the anatomical needs, but not
Differences.
psychological needs are not there.
Right.
They don't understand. So do you think putting such a tool, an AI tool, which take part of your job as Dr. Yasmin, because I'm sure you have a lot of things from even before the patient or the kid come to your clinic, it needs to be ready. You have homeworks or you have each your kid's cycle from getting the pain or getting the symptoms and going to Dr. Yasmin, getting the treatment, doing the follow-up. AI can be implemented in short rules. What rules do you think that can be done by AI with these type of capabilities? For example, starting talking. Let's say Dr. Yasmin will take her consciousness and put it in small mini rules and let it deal with the kids.
I am old school. I wouldn't do that because AI, it's good to have a little robot in the waiting area telling them, brush your teeth and things like that. But that wouldn't stop me telling them brush their teeth and showing them and playing with them. And they will not get love from anybody else but me. And they come to me not because I do a great filling or I do a great crown. It's because I give them love and they give me love back. And that in all eternity will never ever be replaced by AI.
I totally agree with it. But as we are seeing kids, or say the new generations, they have a certain tendency on believing what AI is telling them.
Right.
Unfortunately.
Absolutely, yes.
Unfortunately,
Yeah.
but
kids believe no matter who's telling them what, they will believe it. You know?
So I think the AI in this part, let's say again, I'm not trying to take the part of a nice pedodontist because obviously we didn't have a nice pedodontist when we were young, but
That's why I became a pediatric dentist.
exactly, yeah.
And I remember the horrors back in the day.
Unfortunately, but the thing is, let's try to get AI do something for us. For
Right.
example, documentation of your
That's
kids.
easy. Yes, medical reports. I read them all. Like ChatGPT, write about 2 seconds, done.
And I was again trying to find things which are being done.
Yeah.
Kids monitoring. Now there are some reports that are telling there are smart mirrors, or maybe an idea of a mini small drone, which will be your personal healthcare assistant.
Wow.
Imagine, yeah, and of course, doctor, you know that there are certain models of applications or AI application where you take your teeth picture, and it gives you your oral
Right.
hygiene status.
Right.
So these type of consumer level gadgets, and with the power of AI, do you think those things are going to make a difference in kids' overall oral hygiene?
Well, actually, if kids do believe what everyone is telling them, and then AI tells them, look at this, and AI could do like these little cute videos that animated or whatever. I think yes, because then they would see what's happening rather than just me saying, there's a sugar bug or whatever. And that would leave a lot more impact on their memories of when they came to see the dentist and when they're leaving.
I'm very zealous about this thing, because again, we are starting seeing gadgets based on AI, and I think the kids going to interact with it so much, and
Right.
especially it gives you metric based. Okay, you are not brushing your
Right.
teeth enough. We will send a notification for your dentist.
That's
You-
nice.
you-
Just like Oral-B brushes, the electric brushes. They give feedback. They have, an app.
Yeah, but again, we are trying to stretch a little more. There are models which visually recognize what
Yeah.
you are doing exactly,
Right.
and that
Exactly. It's a whole new level of technology.
is exactly this.
And then I love this notification. Zaid today didn't brush his teeth. Hello, Zaid. Your brush is telling me.
Exactly. I think that's the level of.
That'd be amazing.
That will be the new norm of taking your oral hygiene
To the
care.
next level.
It will be something. Now, other thing is, Victor, I think you have a part of your life as an academic person.
Right. Wow. See,
Okay.
know me too much.
No, too much. But the thing is, now
And it was a great start because it gave me the academic to practice very well. But at the same time, a clinician is different than an academician. So it's good that I had to apply both, because I studied so much and how to present and how to read literature, blah, blah, blah. And then when I'm a clinician, it's like digested.
it's a different thing now. What AI? What do you think of now? I know as an academic, and you are teaching students, one of the biggest challenges for you is to bring a consistency level across all the qualities. So this student has to do basic. This is basic things. Do you think having a tool like an AI can improve or the quality assessment across, let's say, education
Yes.
hubs, and also as a business woman, you are
Right.
going your own venture.
Right.
Dr. Yasmin, she's doing a great job, but
Right.
is her colleagues or her employees taking good care of their kids? Obviously, you cannot see 30, 40 kids in one day.
Right.
Someone else has
I
to see
wish.
them. Yes, exactly. Someone
wish.
else will see them, your colleague, your partner,
Right.
or whatever. AI is going to be a good tool to help you identifying such a
Assess.
yes, exactly, an assessment of shortcomings in your
Right.
patient's care.
Correct. Yes.
What do you think of these things?
I think it's very promising.
Do you do it yourself? Do you do it yourself personally as a human being? Let's call it HI, the human intelligence.
Right.
Are you doing it by yourself, going through the cases of at your academy lifetime? You assess the cases, you evaluate your students. You used to do that thing at that time.
Yes. And we used to keep changing how we assess them, because again, we went from a model of MCQs to assess, but a doctor can't be an MCQ person, is he? Right? A doctor isn't about, or a pediatric dentist or a dentist isn't about doing a class 1 restoration perfectly. It's a lot more than that. So then assessment started from MCQs and essays to being like, let's do clinical. Let's do simulation. Let's do OSCE. Let's, give you a patient with cancer and see how you're going to break their bad news. Let's give you a patient with autism and a child on the spectrum and pretend to see your empathy, your skills, your communication, how are you going to talk to this child, how are you going to reach this child. So assessment went from a flat to the do this MCQ, this essay, and it kept evolving. Now I see for sure that the AI model has, the roof as its limit, especially if, again, you make it work for you. So me personally, as a clinician, let's say today I had a child, I put a crown, but usually a crown has to last 5, 6, 7 years. But this crown particularly fell in a month. So now I come with myself and say, why did this crown fail? Why did this treatment fail? And this is how I learn and improve, right? There are some things in dentistry with a steep curve, like you don't get them easily. You really have to keep at it. And one of those is the white crowns. They are a thing, especially in the pediatric dentistry world. Zirconia crowns, they can fracture easily. So the first time you put a crown, you have to have the HI, the human intelligence, to be like, so what didn't I do there? This is where I want to be. How can I get there? Right? And if you combine HI and AI, not make AI be O, you combine both, then you really have a good chance of being like a super dentist.
Exactly. I think what's going now, Doctora, that more of population, we have the population is growing always,
Right.
and we are dealing with more and more patients, and we are becoming more of bulk practitioners. We see if you are a clinic manager or clinic owner, you need to deal with a lot of data of patients, and dealing with this data tells you a lot
Right.
about your profession, how you are.
Right.
It's a marker, it's an indicator, it's a KPI of how you are performing the quality. So are we going to see such tools that will bring decision making on clinic levels, like owner of multiple clinic levels? That will be something judicial that they help the clinic owners or the clinician themselves to assess bulk of these things. Okay, today I have been doing, for example, a treatment. So it's like doing your own research for your class ones. How many class ones I have, they turn into pulpotomies or pulpectomies. Should I change the quality of my thing? So these different KPIs, using an AI will be much easier to deal with them. So do you think yourself using such a thing or such a tool to help you in assessing your service over a period of time, especially if as a clinic manager or a line manager or a bulk, you have done, for example, for last 2 years or 3 years, hundreds of cases or thousands of cases. I think that needs to be assessed in a way. Okay, this is me. This is what I have been doing. This is the right way. We are not talking about the research. We are talking about your own practice.
Right. Well, yeah. Well, the great thing about AI is it gives you a lot of metrics. It can give you a lot of KPIs, right? But the thing about AI as well, it loops back to you what you want to hear. Right? So you actually have to tell it, no, dig deeper and tell me, how can I improve? Dig deeper and tell me, what should I do more? Dig deep and tell me, what KPIs will really show my success as a business owner? You know?
I think AI has a good potential in pediatric dentistry.
Right. Very much.
But we need to be very cautious.
Right.
It's not your regular patient. Those are not adults.
Right.
And I think data privacy and all
Right.
these are very crucial for the parents to allow them to do these things.
Right.
We are at the introduction only to pediatric dentistry or AI in pediatric dentistry. As a GP dentist, an expert in AI, I see a lot of things happening in other fields and implants and everywhere. But in pediatric, it's a bit slow down. I think that's because of the sensitivity of who we are dealing with. And I don't think it's very soon that we are going to lose our jobs with the AI. And everyone's talking about the robotics.
Happy news.
Yeah. So before we conclude everything, Dr. Yasmin, I want you to just give us an advice to dentists, because this podcast for dentists who are very dependent on AI.
Right.
A piece of advice.
Right.
I think you are the right person to give this because you are the least one to use AI in your daily practice.
Right.
So I want you to give them a piece of advice.
So I would advise budding dentists to use AI, for documentation, for medical reports, for modeling growth, which is something very important now for orthodontic patients or myobrace patients. Use it for, those scanners. Use it in a way that makes the patient journey lighter, but don't get too dependent on it to diagnose, to read an X-ray too much, and above all, don't use it for behavior management or understanding human psychology, because human psychology comes from interaction, from sympathy, from empathy, from love and connection, and that's what our patients need.
Dr. Yasmin, thank you so much for attending and enriching my information about AI. I thought I was an expert in AI, but you have enriched and you fought back about being a human intelligence, not only AI. So thank you so much. Thank you so much for following the video. Follow us, subscribe, and if you have any comments, or I wish if you can share us how you use the AI in your daily dentistry. Goodbye, and we'll see you in next podcast series.
Want to use AI in your clinic? Try Remedico EMR, sponsor of this episode. They are pioneering AI for dental clinics. Go to remedico.app and request a free demo now. Remedico, software for modern dental clinics powered by AI. Hey, and don't miss next episode. Search nextdental one word, no spaces on all major podcast platforms, and click subscribe.